Scituate. I'm Karen Canfield from the Select Board. It is January 11th, 2021. This is the Scituate Town Update. I will immediately, I'm going to just throw it over to our Town Administrator, Jim Bedreau, to give us an update on the current pandemic handling treatment. Jim?
So let's start with some good news this morning. As of 7:45 this morning, we have begun to vaccinate our public safety employees. Sergeant O'Brien of the Scituate Police Department and Lieutenant Downing of the Scituate Fire Department were the first two employees to receive the vaccination. All public safety employees who wish to be vaccinated will be vaccinated by the end of the week. So that is some good news. This is the next step in phase 1 of the vaccine plan. After this will come congregate care settings and home-based healthcare workers and healthcare workers with non-COVID facing care. That concludes phase 1. Phase 2, which is scheduled to start in February, starts with individuals with 2 or more comorbidities for COVID-19, which means people with existing health conditions that COVID-19 would exacerbate, and people over 75. Their phase 2, step 1. Phase 2, step 2 will get us into a majority of our employees. That includes our water and sewer department employees, our DPW employees, and teachers will be in phase 2, step 2. So good news, we are in the vaccination process. As we move along, we'll get better at this. We have not received any guidance as to how the vaccinations will be administered in phase 2. Once we get that, we will roll that out to the community. We are getting calls from some people who are over 75, some people with multiple health conditions asking when and where they'll get their vaccine. The state has not rolled that information out yet. So once we get it, we will pass it on to people. But the good news is we have started vaccinations by the end of the week. The public safety employees that we rely on to keep us safe and healthy on a daily basis will have all received the first dose of the vaccine. Thank you to Eileen Scotty, the public health nurses, and the school nurses that Superintendent Burkhardt has so graciously lent us. They are doing the vaccinations. It started out very well today, and I can tell you the men and women of the public safety departments are very, very happy to be getting these vaccines. It's a load off their minds that they will not be taking this pandemic, this sickness back into their houses. So they're very happy to get this, and it was going very well this morning. So that's the good news. In terms of the COVID pandemic, we had 129 cases since last Monday. That does not include yesterday. So we had 119 cases the week before. We had 129 last week, not including Sunday. We get our numbers Monday morning. Right now, my public health people are busy administering the vaccine, so I didn't get Monday's numbers. So we are up 10 cases in a week with only 6 days of data as opposed to 7 days of data. We will update that as soon as I have the number from public health people. Our positivity rating over the last 14 days was up to 7.93, up from 5%. The state's positivity rating yesterday was 6.6% and is at 7.71% for the previous 14 days. All the positivity rating is the number of positives divided by the total number of vaccines to get the percentage. But that is trending up again, and we are continuing to monitor that. Right now, the town hall is open by appointment only for residents. The library has also closed to browsing and is only available for pickup and drop off at curbside. This will continue for at least another week as we continue to monitor the numbers, but we are doing this to make sure our staff and our residents remain safe throughout the pandemic. You know, Karen, the numbers just keep going up. We need people to be vigilant. We need them to wear their masks. We need them to avoid large gatherings. The vaccine has started, but we won't see a lot of people start getting vaccines until February. So please do your due diligence. Make sure you're doing what you're supposed to do. The light at the end of the tunnel, I think, is here. We're at the beginning of the end, but it's still going to be a while before the vaccines get out to the general public. Cole Parkway project is supposed to start today. People will start seeing the contractor put those pilings in over the next couple of weeks. That is scheduled to be done by the start of the boating season. If you're down Cedar Point, you'll see Cedar Point is a mess. They have begun putting in the manholes. The manhole they put in last week was over 14 feet tall. The hole was over 20 feet deep. It was a pretty substantial excavation closed the road for the entire day, so people need to be aware that that disruption will go on as we work on that project. Finally, the bids are due on the golf course clubhouse renovations on Wednesday. We're hoping that those bids will come in at a level that we can start that project as soon as possible. That's what I have for today.
All right, thank you, Jim. Yeah, just a personal note about the COVID numbers going up and up. You know, there've been, I think, some people a little cavalier that, you know, oh, if I get it, it won't be bad. It's really not about you getting it. It's about who you bring it home to. So as my children remind me, I'm not that young. So they're trying to be careful. And, you know, there's a light at the end of the tunnel. So, you know, please just do your part. And on that, remember that you can still order takeout and you can still buy gift cards. So don't abandon our businesses, but please be safe. I have some more comments, but I really wanted to get to our superintendent, Burkhead, who's here to update us on schools.
Thank you, Chairwoman Canfield. I appreciate that. I too would like to start off with a positive and thank the town for their collaboration in administering of the vaccine and for including our school nurses. Our school nurses have been on the front lines since day one, and it's great to have them part of this process, and looking forward to getting the vaccine out and getting it out as quickly as possible, especially for those who need it right away. Just want to give an update on our COVID situation. Last Tuesday, January 5th, I had to make the difficult decision to move our district to a fully remote learning model. I'm a strong believer that our students learn best when physically in school, which made this decision very difficult. My first priority and responsibility as superintendent is to keep our students and staff safe. We have a comprehensive metric we use to make these decisions, and they are made in consultation with our local medical experts, which includes the Mass Department of Public Health, the Department of Elementary and Secondary Education, the Scituate Board of Health, and epidemiologists. All agreed in this, in our school physician as well. All agreed in this instance that it was necessary under our conditions to move to the remote model for a 2-week window. Share some examples of the impact at the time of the decision. Between December 19th on winter break through January 4th, our town moved into the red category with a surge in cases, including, I believe, a one-day total record of 119 cases and well over a 5% positivity rate. Over the same time period, we had 18 students and 5 staff members in our district test positive for COVID-19. We made every effort to come back to school, and we did for the first 2 days. But then finding out on January 4th, when we came back, we had 11 more cases in the school that day. And on January 4th, we also had 300 student absences, which is well above average, 47 staff absences, well above average, 95 students were quarantining, and 17 staff members were quarantining, along with 2 high school sports team and 2 youth programs. So you can see the collateral effect of this really impacts the school besides simply the positivity rate. We will continue to monitor our metric and school-related cases. An update will be sent out tonight on our positive school cases since we have moved to remote. We typically do that each time there's a new case. But since we've been fully remote, I wanted to wait a few days after the initial news of moving remote, give people a chance to regroup and not pile on with more data every night. Since we're not in school, the schools are safe. We've been contacting any close contacts, but I will be starting that to report those cases out this evening. So stay tuned for that. And then we'll continue regular communications with our medical experts, monitor our numbers in the coming days. Looking forward to our expected return to the hybrid model on Thursday, January 21st. It's important to note that the actions that we take outside of school impact our ability to return and stay in school. And I know this has been mentioned by Chairman Canfield and Town Administrator Boudreau. I want to reemphasize that. We moved to a remote learning not because of school transmission, but because the numbers in our community were so high, it impacted our ability to offer safe learning environment in our schools. I cannot stress enough how important it is for families to cooperate and have conversations with your children about following state, town, and local guidelines, including avoiding large gatherings, social distancing, and wearing a mask. I'm optimistic that if we all collectively are responsible in doing so, we will be returning to school and staying in school. So that's really important. And I just wanted to share with you what I call the collateral damage of the virus. If someone in your family has it that's not even a member of our district, but their parent is a teacher or their brother or sister is a member of our school community, they quarantine and are not able to come to school. So we saw, or you heard today, those numbers were so high that it impacted the way we conduct our learning. Next, I'd like to just share a response to the Capitol building incident last week. I know it happened after this report went out. I did share something with the community. I just wanted to share what I did share with them. As I reflect on the events occurring at the United States Capitol building on January 6th, my heart breaks for our country. The acts of violence and attacks on our democracy carried out at the Capitol are not a reflection of who we strive to be as Americans. To me, this is not about politics or ideology. It's simply about right and wrong or good and evil. Our country now more than ever needs healing, unity, and love. What transpired at the Capitol represents torment, division, and hate. Let's use this tragedy as a teachable moment and opportunity to denounce these behaviors and any violence. Let's rally together as role models for our children and have candid conversations about what transpired, that it was unacceptable, and that we must not tolerate hate in our homes, schools, communities, and country. Let's show our children through our actions that we are better than this. After all, we are all Americans. And let's lean on each other for support and strength. And I also want to share how proud I am of our school district, our teachers, our department chairs and coordinators, and our principals and central office administration went right to work right after the incident happened on getting resources ready and being prepared to, work with our students the next day. That topic obviously was going to come up. We needed to be prepared, and we were remote, which makes it a little more challenging. But I want to say we were fully prepared. The teachers had the resources. They were ready to communicate with the kids and the families. And I want to commend them for that. And lastly, just a reminder that we have a school committee meeting tonight at 6 p.m. It will be fully remote. Information has been sent out, so we hope to see everyone there. Thank you.
Thank you, Superintendent. There's a lot of information, guys, so feel free to listen to this broadcast. I do want to note that, as you can see from the presentation, we are doing this meeting via Zoom. That is to, I actually asked for that because we have two people on this call that run our town and our schools, and I think it's important that we can, that we all do what we can to keep each other safe. So I stayed away from them. So most of you will see this later. We will have board meetings are by Zoom as well for the select board. We met last week and there were two really important conversations. One was an update from our water department, which they do quarterly, just to let us know where things stand with the efforts that they are undergoing to improve our water supply and condition. And the other was a discussion about what we can do to help mitigate the people that are negatively impacted by the wind turbines operation. As many people know, that conversation has been going on for a while. So we had a very robust conversation about that if you want to tune in. Next week, we will be meeting as well, and the majority of that meeting will be to continue our review of the fiscal 22 budget, operating budgets, but we will also be reviewing the Hummerock fire station contract, and as Jim mentioned earlier, the Widows Walk Golf Club renovation contract. So those are upcoming, it's on video. And to the superintendent's comments, thank you so much for taking the lead, as you have done so much during all of these crises to make sure that our kids and our teachers are prepared for yet another series of difficult conversations. And I'll point folks to the Mariner. They wrote a nice article quoting sort of other community leaders' responses to the Capitol situation. And unfortunately, I am going to end on a sad note for our community. We've lost another lion. Peter Levitt, who was town moderator for the town of Scituate for 19 years, as well as serving on multiple committees throughout his lifetime, has sadly passed away in January. So our condolences go out to his family. So many of them are here in Scituate. So he was a great man and he will be missed. So the board and the town sends our condolences. And with that, that's all I have. Gentlemen, do you have anything else you want to add?
I just wanted to add one other thing. Both the superintendent and I mentioned the cooperation we received from the school nurses in the vaccination process. people should be aware that as part of that, the nurses were vaccinated also. So it's not just public safety. All the school nurses who have wanted one will have received a vaccine also. So that's very important to the schools and to the health and safety of those nurses and the students. So thanks to them, but I wanted people to know that we're not putting them in jeopardy. They've been vaccinated also.
Great. Thank you. It's a very, very comprehensive plan. I've seen the outline of how it's being rolled out, and I commend everybody for, figuring out how to get it done once again. So with that, I hope everyone has a good Monday. It's supposed to be a beautiful week. Get fresh air, wear your masks, and just, remember just to follow the guidelines till we get out of the woods here. Thanks so much.